West Africa's water crisis is about more than simple thirst. It's a complex problem we often misunderstand. In reality, it's a silent killer. Unsafe water causes 115 deaths every hour in the African region. This crisis isn't just about what's in the water. It's about the staggering journey to get it. Every day, women and girls collectively spend 200 million hours simply walking for water. How does this daily walk ignite a crisis of health and equality? And what are the overlooked solutions? We will connect the dots. The scale is immense. Over 400 million people in sub-Saharan Africa lack clean water, more than the US and Canada combined. The direct impact is on health. Contaminated water leads to over 500,000 diarrheal deaths annually. 395,000 of them are children under 5. This crisis floods into classrooms. Schools without proper sanitation see girls drop out, especially after they start menstruating. We've seen the devastating effects on health and education. But what are the underlying forces driving this? One hidden driver is environmental damage. Deforestation directly reduces the availability of fresh water in regions like Nigeria and Niger. Climate change is a threat multiplier. Rising temperatures and lower rainfall mean longer, harder journeys for the same amount of water. But the most profound mechanism is social. That 200 million hours is lost potential. This is reinforced from the top. With only 17% of water ministries led by women, their needs are often overlooked. And this daily burden creates a direct safety risk, increasing exposure to gender-based violence on isolated routes. Systemic barriers stop progress. Corruption and poor management can halt water infrastructure projects before they begin. Even when a well is built, the work is not over. Without maintenance and training, new sources fail or become contaminated. Behavior adds another layer. Families may switch from a paid clean well to a free, unsafe river in the rainy season. Is this situation hopeless? The situation can feel desperate because we fundamentally misunderstand the problem. We assume West Africa is simply running out of water. The surprising truth is it isn't. Most nations there have enough groundwater to last 5 years of drought. The water is there. This hidden groundwater is a lifeline, a sustainable source waiting to be tapped as surface water becomes less reliable. So why isn't it used? Funding. The human right to water doesn't mean free water. It means affordable access, which requires investment. So the problem is not a lack of water, but a lack of access. This means your support can be incredibly effective. Let's reframe the solution, not as charity, but as one of the best investments we can make in human potential. The data is clear. For every single dollar put into water and sanitation projects in the region, the economic return is at least $7. Remember those 200 million hours? An accessible well buys back that time. It's a direct investment in female education and enterprise. And the 505,000 diarrheal deaths? Donation support funds health by preventing disease at its source, one of the most effective health interventions. So we've seen West Africa's water crisis is not an unsolvable problem of scarcity. It is a solvable crisis of access. Providing clean water is the single key that advances progress in health, education, gender equality, and economics all at once. The 115 deaths every hour are not an inevitable tragedy. They are the direct result of this solvable problem. Your support is fundamental. Donations to organizations working with communities on sustainable projects are a high-impact investment. Help turn on the tap for a healthier, more equitable future. Find a reputable charity to contribute to water solutions in West Africa. This delivers clean water, but it also sends children to school and empowers women to build their communities. For a young girl, it means a chance to stay in school, to stay healthy, and to build her own future. This is what your investment builds, a future. Learn more about high-impact water charities and how you can help create lasting change.